As a licensed physical therapist, I see even the most advanced lifters have dysfunctions in those RDLs. Whether you're recovering from an injury or you're just trying to lift heavy, this one's for you. As you probably know, RDLs are one of the best hinge movements to really develop those glutes and those hamstrings and that entire posterior chain, but they're often done incorrectly. There's a lot of different ways to do RDLs, but I'm gonna give you a physical therapist standpoint view to how to stay out of pain or get out of pain and prevent any injuries when you're doing RDLs and make that exercise a most effective posterior chain exercise. So first off, with RDLs, we gotta take the shoes off, because if you look at shoes, they have an inclination of the toe. Doesn't matter what kind of shoe that you're wearing. Take the shoes off and let's go barefoot. The reason why I like to take the shoes off is because our feet should be our counterbalance. All of your weight should be on your heels, but how we make sure we're actually hinging and really sitting those hips back is having those toes engaged to the ground, specifically that big toe. As silly as it sounds, there's a lot of research that supports that big toe engagement correlates to glute engagement. So if we can get those big toes counteracting that ground, it'll help us sit back a little bit more, because if we're coming back like this and I don't have those toes engaged, what's gonna happen is you're gonna bend a little bit more forward in the back because you can't get the stretch back here. Next piece of the puzzle has to do with pelvic positioning. A lot of times people don't even have the flexibility in their glutes and their hamstrings to truly stretch and come out. So what happens is if they don't have that flexibility, they try to cheat it by posterior tilting at the pelvis or rounding at the back, because you're not able to keep your pelvis neutral and stretch those glutes and that hamstring. So this is a fantastic exercise to focus on flexibility. You can also do other things. Check out my Instagram for all those kind of exercises for hamstring and glute flexibility. So what you want to think about doing is when you're doing these is we are sitting our hips back, allowing those glutes and those hamstrings to spread apart, almost like you have a string attached to your tailbone and it's pulling you back and you're pulling those butt cheeks apart, okay? So sitting it back as far as you can, you're looking for the biggest possible stretch that we can get to then squeeze and contract. The more stretch you can find in a movement, that means that we're gonna be able to bring those muscle bellies closer together. So look for those stretches in those movements, make sure we have that pelvis and that low back nice and neutral before we go and shoot those hips back to get that flexibility in those glutes and hams. The last mistake that I often see is when people are going down into the RDL, they're not actually engaging those glutes until about the last third of the movement. So that's the last part that we're getting hip extension. So once you take this concept, if it's a neuromuscular drill in our brain, it's called a contract relax. So what I want you to think about doing is we get to that lengthened position and then we get there and we just think about contracting the muscle that we're intending to work. So here we're glutes and hams. So I want you to think about just contracting those glutes and then relaxing them. Contracting those glutes, relaxing them. Show your brain that you have that muscle engagement and we're using that first and we're not just letting that low back do all the work. So when we come up, we're almost letting that glute come up and scoop underneath as the back just follows along. So the biggest take-home points when we're doing RDL from the ground up. First, it starts at our feet. So again, all of our weight is in those heels. We just have those toes as counterbalance. So sitting those hips back. Next, keeping that pelvis nice and neutral, not rounding forward. So keep that pelvis, let those butt cheeks spread back and really stretch. Then from there, we're making sure we have that squeeze with the glutes first. Practice that contract, relax, even with weight. Contract and then come all the way back up. Okay, so sitting those hips back as far back as we can, gripping with those toes to then squeeze, engage, come back up. Remember, so next time you load up an RDL, it's not just about going through the motions. Small changes can make a big difference because remember, it's not about what you do, it's how you do it. So go ahead and like, comment, subscribe. I want to know in the comments what kind of movements you guys want to see that you want to see a physical therapist perspective on. So let me know and I will see you guys in the next one.